You are watching the Kenny Report. We're going live to Canberra now to hear Prime Minister Scott Morrison address the media.
The issues of young Australians who find themselves in aged care facilities around the country. I said at the time that I believed it would be a very uncomfortable exercise for all Australians as we listened to the stories and were shocked and disturbed at the treatment of our older Australians in their moments of greatest vulnerability. I think there are a few families around the country, my own included, who are not unfamiliar with the difficult decisions that are made about relatives and loved ones who are placed into aged care facilities, whether those are residential facilities or they're accessing in-home care. It's a very sensitive issue and a rightly so for all Australians. And in commissioning the Royal Commission, my intent was to ensure that we could shine quite a bright light, that we could learn deeply from the experiences and the practices that the Royal Commission was able to identify, and to assist us deal with an issue which is not new. The Royal Commission's interim report has talked about settings and processes and issues that are not new, that go back over many administrations over a long period of time. But it befalls to our government to be able to address the issues that are being identified out of the Royal Commission, and as we've had the interim response report from the Royal Commission, it is now our task to provide an immediate response to that interim report, as I promised I would do before the end of the year, addressing the specific issues that they highlighted in that interim report. These responses together do go to those matters, but I want to stress again that what we really need to establish above and beyond everything else is a culture of respect for older Australians. That this cultural change that has once again been highlighted, I think, by the interim report of the Royal Commission, that requires a broader response than just from governments. It's something that goes, I think, to each and every Australian home and family around the country. And so we will do our part as part of making that shift in that culture, and also to do the practical things that are necessary now. Of course, there will be further responses that will be made in this area. There will be further responses in the budget. There will be further responses in respect to the final recommendations of the Royal Commission and or other matters as they arise. Today's announcement is our immediate response to the matters that were highlighted by the interim report of the Royal Commission. So let me run through these. There will be an additional funding package of $537 million provided to the health portfolio. That will address three priority areas. The first is investing just under $500 million for an additional 10,000 home care packages. Secondly, there's just over $25 million to improve medication management programs to reduce the use of medication as a chemical restraint on aged care residents and at home. There will be $10 million for an additional dementia training and support for aged care workers and providers, including to reduce the use of chemical restraint. And there will be additional funds, just under $5 million, to help meet new targets to remove younger people with disabilities from residential aged care. And I stress that funding is in addition to the funding that already exists within the National Disability Insurance Scheme, which I will ask the Minister to speak of directly. Now, this work, in terms of addressing the issues that were highlighted in the interim report of the Royal Commission, reflects work that is already underway and has been for some time now. Already, we have increased the number of in-home care places by 44,000 since the 2018-19 budget alone, at a cost of some $2.7 billion, including today's announcements. Already, we have seen the number of young people in aged care facilities fall from 6,287 to 5,606 on the most recent information, and there is further work to do there, and the Minister will set out the works that we have in train to also address that goal. But before handing over to the Health Minister, I want to assure all Australians that we will deal with these issues as you would if you were standing in my shoes today. I know quite precisely the sorts of things that you are thinking about at the moment when it comes to the treatment of your loved ones in aged care. My family is no different to yours in that respect. And so I have a very deep understanding of the difficult decisions that you're having to make, the conversations you're having to have with the partners, husbands, wives of those loved ones going into care, other siblings. This is hard, and you just want to be assured that they're going to get the care. I want that as much for your family as I want it for mine, and I want the response of our government to have that same level of deep care and responsibility. Greg.
Thanks very much, Prime Minister. Firstly, to acknowledge...
You're watching the Kenny Report. We'll stay live with this press conference from Canberra. Just some news I wanted to bring you up to date on. There has been confirmation that Scott Morrison had a phone call this morning with President Donald Trump. The Australian Prime Minister spoke with the US President on the phone this morning. The phone call was set up to thank the Americans for helping to free Australian hostage Timothy Weeks from Afghanistan last week. So Scott Morrison thanking the President in that phone call, but also confirmation they did, of course, talk about issues relating to China and continuing negotiations to strike a trade deal between the US and China. No confirmation as to whether or not there was any discussion of the latest controversies involving espionage, China and Australia. Just bring you up to date with that news. Scott Morrison spoke on the phone this morning with US President Donald Trump. He's bound to be asked about that again as well after these announcements. Let's go back to Greg Hunt, the Health Minister.
The home care and home support programs. That is a long-term reform which will bring about a very significant change. Tailored care for our older Australians, whether it's in-home with lower needs or in-home with higher needs. And we're going through a fundamental change already, but this is an absolutely indispensable step forward to make this home care system something which will address the needs of every senior Australian. Secondly, as part of that, there is the immediate provision of 10,000 places, and those places are about ensuring that there's additional care, and that is tailored to meet the capacity of the workforce to expand. The Commission was very, very clear on this, as was a previous Royal Commission, about the need to expand the workforce in line with the capacity for safety and quality, and that's been a very important part of our deliberations on that front. And then as we do this, we will also have a single assessment process. That then brings me to what we're doing in relation to dementia and medication management. The Commission found that there had been medication management used as a form of chemical restraint in circumstances. We immediately acted on the day of the report to have the safe and quality use of medicines raised through the COAG Health Council to be a national health priority for the first time. Now we are moving, as of the 1st of January, to ensure that the medicine risperidone is only available for a 12-week period without a subsequent approval. This is a very, very important step forward. Risperidone has been identified as an antipsychotic which has been the subject of overuse and overprescription for chemical restraint purposes. We have worked with the PBAC, with the AMA, the College of GPs and with other parts of the medical and health profession. This will provide a break, a restraint and an oversight on the use of antipsychotics in our aged care homes to protect our residents. As well as that, as the Prime Minister mentioned, there will be $25 million for medication management to ensure more frequent medication management, and $10 million to support the training of dementia workers in terms of aged care. So it will support them be able to better provide for, better care for and better take care of our senior Australians with dementia. Minister Robert will address in more detail what we're doing with younger Australians in aged care, but the bottom line is that we are accepting the 3 goals which the Royal Commissioners have set out as being the new targets which Australia should embrace.
Thank you. Richard.